Dixon Center started when Dave and I were on the Joint Chiefs of Staff, and Dave was working directly for Admiral Mike Mullen, the chairman. And Admiral Mullen came back and said, I'm out traveling a lot, and we get the question that people want to help veterans and those touched by military service, but they don't know how. So Dave was charged with kind of answering that question and going out into the communities and trying to connect resources and needs for our veteran population at a time when people were leaving the service due to discharge post-surge in Iraq and Afghanistan, and the needs were very high. So that was how the Dixon Center was born in 2012, a center of excellence that enables organizations and individuals across the country to maximize their impact on veterans and those touched by military service in the communities where they live. I think we're kind of doing that. The good side of that question, that shouldn't be a good side, but it is, I kind of talked about a little bit earlier, is that a lot of our veterans today are pretty tech savvy. They know their way around a computer. And a lot of our older veterans who didn't want to be tech savvy have learned to get around a computer, which has encouraged and enabled them in ways that they might not have been before. But I think what we really need to focus is on communities. Again, every community is different, and everyone's operating very differently in this environment. I live in rural Maine, and there's, I think, 4 people in the hospital in the state that have COVID. Obviously, very small, spread out area, and that allows us to do a little bit more interaction, both physically and over systems like this. That's not the same across the country, obviously, but I think what we can do to affect that change, one is systems improvements, but 2 is building community connections in whatever means you can, whatever that transportation means is. Affinity groups and communities reaching out, whether it's a veteran service organization or an organization at the hospital, people with similar challenges, any kind of those that bring people together. And consistency, I think, is the most important thing, because the people that suffer in this system are the ones who fall in the cracks, are the ones that fall out of routine. We like to call it battle rhythm. We like to call it whatever you want. But if there's an expectation of attendance, performance, and interaction on a positive level, people will keep coming. It's when we get kind of a little sloppy in our discipline of interacting with people, that people will just check off the net literally and go to their place where they're keeping secrets, and that's not a healthy place for anybody. So I really think it is organizations, like-minded organizations, coming together and having a disciplined dialogue over time as systems develop. That's kind of a mamby-pamby answer, but everything that I kind of focus on is that center of gravity in your community, whatever it is. I kind of want to finish up with almost a kind of call to action for all of you. I talked about the devolving needs. We're going to go back. We're going back in time. We have an opportunity to do these things over again and do them better. When we had the employment crisis for veterans, again, it was focused on just getting jobs. We need to move back to let's get careers for these folks. We kind of get a devolved do-over, for lack of a better term. There are a lot of things that we have learned, and there are a lot of things that we've set aside during this pandemic. I think what every organization here that's talking today needs to have a COO, and not your traditional COO. You need to have a chief opportunity officer. You need to have somebody that's sitting in the corner that's paying attention to the things that you really don't need to do anymore, and paying attention to the opportunities to pivot or change your model. And a lot of organizations are doing that, but too many aren't. And we need to do that in the veterans and military family space as well. This telehealth is a good example, but we do have to find ways, new ways, to reach out to those veterans who are isolated and to their family members that are suffering. I really think we have a great opportunity today during this discussion to address many of those issues, and I really hope that If you have any questions at all for myself or for Colonel Whitehurst or Colonel David Sutherland, reach out to us at dixoncenter.org. I'm sure emails will be provided. We'd love to talk to all of you because, like I said, this work may not put food on our table, but it feeds our soul, and it's very important to us.